Welcome back to Midweek Politics. I'm David Pakman. Thanks for listening. Please check out our website at midweekpolitics.com. You know, I was watching C-SPAN the other day, Lewis, and they had one of these shows where people called in and asked questions, and it was all healthcare related. And I heard some of the most unbelievable calls that I'll just tell you about them because they make absolutely zero sense to me. One said, "I am sick and tired of the government trying to shove healthcare down my throat. I'm with the VA, and I don't want my health insurance to change." So a guy who has not only one of the best health insurance plans that's around, but it also happens to be a 100% government-run healthcare plan is saying he's sick of the Obama administration trying to shove healthcare down his throat. If the government didn't run healthcare, he would have no healthcare. It's amazing. It's such a fundamental thing, and this is exactly when I think about when people say the public option is or isn't supported, government healthcare is or isn't supported. If this is the understanding that a lot of these people being polled have, which is that they don't want the government involved with healthcare, they want their VA healthcare, then how are these polls even remotely accurate when there's such a low barometer for understanding what kind of healthcare one even has? It's amazing.
That's why I always say to not pay attention to polls. And I also believe that if nothing would change for the VA healthcare system, I mean, nothing would change with Medicare. I mean, nothing that's in place right now would change.
There's an argument that Medicare would be less well-funded so that there's a potential that doctors would be getting reimbursed less for taking care of Medicare payments and therefore might be inclined not to accept them. Depending on who you believe and what numbers you believe,
right,
that may or may not be true. Another man called in who is on Medicare, and he said, "Keep the government out of my Medicare," referring to the decreased funding for Medicare. Medicare is the government. The government is Medicare, and it's such a fundamental thing. Keep the government out of my Medicare. Someone should have told this guy the model around which some think government care should be based is Medicare, which, by the way, is 100% government run. And I don't know that we can just say, let's not pay attention to polls, but I think somehow it's abundantly clear that people are not being educated well enough. If people who have VA healthcare and Medicare don't know that those are government plans, I mean, do they think that it's a private insurance plan? I don't know. How can, Lewis, how can we better educate people?
That must be it. What else could they possibly think it is?
I have no idea. I mean,
that's it.
Veterans Affairs, what could that possibly be? Medicare. What private insurance company is that? I don't know. I really don't know. And I know there's confusion because Medicare supplement plans may be provided by private insurers. But it doesn't make sense to me. There needs to be some better level of understanding here about where is people's health care coming from. I don't know.
I think of all recent important issues, well, with the election, it was the tax thing was huge. Most people had no idea what either candidate's tax plan actually meant.
Right.
And now I think this is
it's spreading
10 times that.
It's spreading to healthcare, absolutely. Yeah. Well, Congressman Anthony Weiner says tons of Republicans in Congress are already on the public option, and that could be the government plan that is provided to those over 65 called Medicare, and of course the fact that they're all on some kind of government option because they are government employees. Take a listen.
What do you have to tell us?
Well, it's more kind of another way of looking at this debate and discussion about the public option to put in focus. We wanted just out of curiosity and looked how many members of Congress get the public option. And I know a lot of people have said, well, under the new bill, how many of you members of Congress would choose the public option? Well, there already is one. It's called Medicare. And we found that 55 Republicans and 151 members of Congress are on Medicare right now. So they're already getting the same type of public option that we'd like people who are without insurance to be able to get. And I guess the purpose of this list was to kind of point out some of the hypocrisy of this debate. You have members of Congress thumping their chest how they're against government health care, against government-controlled health care and socialized medicine, and yet when it's time for them to accept Medicare, they're like, sign me up. And part of what I've argued in arguing for a single-payer system is that, well, we have Medicare for those that are 65. Why not 64? Why not 24? Like, you're about 24, I'm sure.
Sure.
And why not have that type of a system that has lower overhead, lower costs, and you don't have to deal with the 30% in profits and overhead that insurance companies take?
Okay, of course, the counter argument to that is that, well, it's not really 30% overhead. And if you start reimbursing only 70%, doctors will stop taking it. But Anthony Weiner is right that a lot of the hypocrisy is coming from those who have some kind of a government or public option. I don't know what kind of health insurance you have, Lewis. For the last few years, I've been covered by being a full-time graduate student. At the end of this year, I'll have to get insurance through my business. So I started exploring options. It's amazing, and I was aware of a lot of these things, but I became acutely aware when I started getting down into the nitty-gritty of exactly what type of insurance I'm going to be getting. Number one, unless your employer is paying for dental insurance, I believe that it almost does not make sense to have dental insurance. And what I mean is this. I took a look at several plans, and there's one option with a lot of the companies. If you're under 50 years old, which I am, it's $49 a month. Excellent. So what does that cover? Well, it covers 2 cleanings a year, and it'll cover 80% of all the dental work that you have done, up to a maximum of paying $1,000. So what does that mean? If you have 2 cleanings a year and 2 cavities a year, a cleaning's about $125 here, cavity's about $150. If you have absolutely no insurance, you're paying out of pocket $550. 2 cleanings, 2 cavities. If you have insurance at $49 a month, that's $600, and it'll include your cleanings. Of course, if you have those 2 cavities, you have to pay 20% of those. That's another $60. Exact same amount of dental work. Without insurance, $550. With insurance, $660. You pay more having insurance. Now, I know you might say, well, wait a second. What if there's some kind of dental catastrophe and you end up having, I don't know, I fall down during the show and I chip a tooth, or the tooth, even worse, the tooth has to be completely replaced. Mm-hmm. Expensive. Could be $2,000. Okay.
That would be funny.
What wouldn't be funny is this. Let's think about how will that affect insurance. If you have insurance, you would pay $600 for the insurance, and then they would cover 80% up to a maximum of $1,000, which means they'd cover $1,000. That means my total expense for the year, $2,250, or rather $1,600. If I don't have any insurance at all, I'll pay for my 2 cleanings, $250, and the $2,000, $2,250. It's almost the same thing. It's almost, literally, the only way that you will benefit from paying for dental insurance is if you have exactly between the amount that the insurance costs and the maximum benefit, which in this case is only a $400 range. So needless to say, it's not going to make any sense for me to pay $50 a month for dental insurance, if you know what I mean.
Right. We're semi-generalizing here, you know.
I don't know that we are. If your employer is paying for it, yes, it absolutely it might cost you $2 a month, $4 a month, whatever. But at $49 a month, knowing that the maximum yearly benefit is $1,000, it makes absolutely no sense. Given my normal thing is
different providers, different plans though.
But they're all in Massachusetts. They're all very similar.
State, yeah.
In this state, they're all very similar.